Anxiety disorders affect anyone at any age, and they are the most common mental health problem. Anxiety disorders can be triggered by a specific event or stressful life experience. Advice isn't a set of instructions. It's more like a paint supply store. You give the seeker the colors and the canvas, and it's up to them to make something out of it, or ignore it altogether. The theme for the next few days will be anxiety disorder. So to start off, we will look at anxiety disorders as a whole. Although researchers don't know exactly why some people experience anxiety disorders, they do know that there are various factors involved. Like many other mental health conditions, anxiety disorders seem to be a result of a combination of biological, psychological, and other individual factors. Researchers know that the problems with brain chemistry can contribute to the development of anxiety disorders. Certain neurotransmitters, chemical messengers in the brain, involved in anxiety include serotonin, neuropyrone, and gamma-aminobutyric acid, GABA. Researchers have also shown that changes in activity in certain areas of the brain are involved in anxiety. Many anxiety disorders run in families and likely have a genetic cause. Certain medical conditions such as anemia and thyroid problems can also cause symptoms of anxiety, as well as other factors such as caffeine, alcohol, and certain medications can cause anxiety symptoms. Traumatic life events such as the death of a family member, witnessing a death, war, and natural disasters may trigger anxiety disorders. Who does anxiety disorders affect? Anxiety disorders affect anyone at any age, and they are the most common mental health problem. Anxiety disorders can be triggered by a specific event or stressful life experience. They may be more likely to occur if you have a specific way of thinking, such as trying to be a perfectionist or trying unhelpful coping strategies from others. However, sometimes there doesn't appear to be a trigger or reason. In certain anxiety disorders, the person affected might become obsessed with certain rules or behavior and get very upset when other people don't follow those sets of rules. Anxiety disorders include the following: phobias, panic disorder, agoraphobia, social anxiety disorder, generalized anxiety disorder. Each anxiety disorder has its own specific treatments and goals. However, the most common are counseling and more specific CBT, cognitive behavioral therapy. CBT teaches you how to deal with your thoughts, feelings, and behaviors. The goal of CBT is to identify and change unhelpful patterns of thinking. CBT will help you to replace your behaviors with helpful strategies. Medication. Anti-anxiety and antidepressants might be prescribed. The medication helps with the physical feelings and anxiety thoughts, the intensity or frequency, so you can seek real help in CBT. Support groups. Both online and offline support groups can be a great place to start, as well as continue, so you have a safe place with like-minded people to share your feelings with. Self-help strategies. Different skills can help people with anxiety, and it could help to hone them. Some examples are problem solving, stress management, relaxation, mindfulness, developing awareness of the present moment and judgment, as well as good health such as eating, sleeping, exercising, and personal hygiene. The following is a list of symptoms of anxiety. If you're experiencing any of the following on a regular basis or for no reason at all, you should talk to a healthcare professional. Excessive worry, persistently thinking, anxious thoughts about everyday things, both big and small. Sleep problems. Trouble falling asleep and staying asleep due to worry or agitation for any reason or for no reason at all on a constant rate for 2 weeks straight. The other side is you wake up wired and can't calm yourself down. Irrational fears. Everyone has a phobia, something they are afraid of. However, if you are consistently thinking of the thing and it becomes overwhelming, disruptive, and way out of proportion to the actual risk involved. Muscle tension or near constant muscle tension. Whether it consists of clenching your jaw, balling your fists, or flexing muscles throughout your body. You may not even notice yourself doing this. Chronic indigestion. Anxiety often manifests itself in the body through physical symptoms, like chronic digestive problems, irritable bowel syndrome, IBS, a condition characterized by stomach aches, cramping, bloating, gas, constipation, and/or diarrhea, is basically an anxiety in the digestive tract. Stage fright. If the fear is so strong that no amount of coaching or practice will alleviate it, or if you spend a lot of time thinking and worrying about it, you may have a form of social anxiety disorder. Self-consciousness. Anxiety provoked by everyday situations, such as one-on-one conversation or eating and drinking in front of even a small number of people. Panic or panic attacks can be terrifying. Picture a sudden, gripping feeling of fear and helplessness that can last for several minutes, accompanied by scary physical symptoms such as breathing problems, a pounding or racing heart, tingling or numb hands, sweating, weakness or dizziness, chest pain, stomach pain, and feeling hot or cold. If you experience this repeatedly, you might have anxiety. Flashbacks. Reliving a disturbing or traumatic event, even if the event was not life-threatening, such as an embarrassment at work or being bullied. Perfectionism. Compulsive behaviors and self-doubt. If you have an anxiety disorder. Anxiety disorders are real disorders that affect your well-being. You might think you have to get over it on your own time. This is not true. You don't need to get over it. You might even be unable to understand how to get over it. You may not know how deeply your anxiety affects your life. Knowing that you have a mild case of anxiety is a good thing. Seeking help is better, and knowing how deeply it affects your life can change it for the better. It's important to talk to a healthcare professional if you think you have some form of an anxiety disorder. How can you help a loved one? Support is always a big thing in any disorder. Support can be a delicate balance, but you should expect recovery eventually. You just have to have hope while supporting them. Try to remind yourself that the person has the disorder. They are not the disorder. Be patient. Learning new coping skills will take time. When your loved one is learning these new skills, you might want to practice with them. It can help you bond and bring you closer. As with anything, some people just want to be heard. They might start off the conversation sounding as though they want advice, but are not. They are just looking for a sounding board. If they are looking for a board, be that board. It can help you empathize with them. Try not to push unwanted advice on them. It's okay to set up boundaries. If the trust is getting to be too much, or you think it might become too much, reach out to someone you can trust not to gossip and discuss your stress with them. You might want to consider family counseling, at least for a little while. That way everyone gets to express their feelings in a safe place. Seeking help is not a life sentence. Once you can manage your disorder, it can no longer rule your life. Please note that any advice I give here should be taken with a grain of salt. Everyone's life is a different story, and these are merely generalized tips. Results will vary. If you would like to ask me for advice, please email or Facebook me. My links are in the description. I know you can pick any YouTuber to watch, so I just want to thank you for picking one of my videos. I hope it helped.